thank you for this opportunity to present the Pandemic Fund. And I hope we'll have a chance to meet and interact in real time. But for now, just a quick summary. Last year, the international community came together to establish the Pandemic Fund, drawing on lessons learned from COVID-19. The Pandemic Fund is an innovative addition to the International Health Financing Toolkit, a first of its kind, a multilateral platform dedicated to making investments in pandemic preparedness during peacetime. It's designed so that when the next pandemic strikes, and we know it will, low and middle income countries will have the capacity to address it. Its scope covers investments to strengthen country and local capacity in core domains of the International Health Regulations 2005 and WOA international standards, including disease surveillance, labs, human resources, emergency communications, coordination and management, and community engagement. Its scope also covers building regional and global capacity across multiple domains, including collaborative surveillance, reporting and information sharing, shared public health assets, regulatory harmonization, and capacity for coordinated development, procurement, distribution, and deployment of countermeasures and essential medical supplies. And it seeks to support technical assistance, analytics, learning, and convening. The goal is to get ready for the next global health threat. For example, by having a health workforce that can be rapidly deployed in the face of a crisis, laboratories that can quickly ramp up testing, and surge capacity that can be called upon to respond. The Pandemic Fund is doing things differently because it has the flexibility to work through a variety of institutions, what we call implementing entities, complementing efforts, drawing in co-financing, and promoting coordination on the ground. Plus, importantly, it incentivizes countries to prioritize this agenda and increase their own effort. The World Bank and the WHO worked closely together with G20 members and other partners to develop the Pandemic Fund last year at record speed. The Secretariat is at the World Bank. We have a technical advisory panel that's chaired by the WHO. The fund is governed by a board that includes balanced representation from the Global North and Global South. What makes the Pandemic Fund impactful is the collaboration with governments, with the WHO, other UN agencies, multilateral development banks, global health initiatives, philanthropies, civil society. In less than a year, we've raised $2 billion in seed capital and moved forward quickly with implementation. We've already awarded the first round of grants totaling $338 million that will mobilize over $2 billion to help 37 countries strengthen their capacity to prevent, prepare for, and respond to pandemics. So every dollar awarded is catalyzing an additional $6. All geographic regions are covered by the 19 projects selected for funding under the first call for proposals. 75% of the projects are in low and lower middle income countries, and 32% of grants allocated are for sub-Saharan Africa. Almost all projects take a One Health approach and include AMR surveillance. Each project brings multiple implementing entities together in a coordinated way. And several projects include cross-country collaboration and regional capacity building. What our first call for proposals has demonstrated is that the needs are urgent and enormous. We received grant requests from 133 countries for an amount that was 8 times the funding envelope. To maintain the momentum, our board is aiming to launch the next round of funding before the end of 2023, and we will draw on lessons learned. But to fulfill its promise of helping developing countries build resilience to future pandemics, the Pandemic Fund needs more resources on a sustained basis. Joint analysis conducted by the World Bank and WHO for the G20 last year estimates that getting to the right level of preparedness will require an additional $10 billion or so of international financing annually over the next 5 years, coupled with twice as much in domestic financing. So this is the moment to scale up efforts, and we count on your support. Thank you.